Hey, Professor, it's Joe Valdez, and this is my mom, Norma Valdez. She's going to help me with the second career interview. And my first question for you is your current job title and position, and for how long have you held?
I am a physical therapist assistant, and I have held that title for 12 years, and I am currently working at a home health agency.
Any type of training required for you to land the job that you have now?
Yeah, to be a therapist assistant, you have to have 2 years of prerequisites, which is your general education, plus a lot of anatomy and science classes, and then you're in the PT program for about 2 years, which includes clinicals and internships.
How did you land a job position?
My first job out of school was at a hospital. I worked there for about 6 years, and then I worked for a senior therapist who then opened up a home health agency, so I had somewhat of a connection and worked with him into getting a position in the home health field.
Can you name some pros and cons about your job?
Pros for working where I'm at right now. Again, I'm working at a home health agency, and we primarily work with joint replacement patients with 1 or 2 specific doctors. So the pros are that we know the doctor's protocols to a T and know exactly what the physicians require from their patients within the first 4 weeks after surgery. So our patients do very, very well. Cons of the job are actually in the home health field, the cons would be you're just driving around a lot from home to home, so you're using up a lot of gas and mileage, and you're on your own, but if you're okay with that, then you should be fine. But if you're a people person and like to be around other staff, then that'll be a con for you.
Okay. Why did you choose this type of work?
Well, I've always enjoyed the health field and knew that I didn't want to be a physician or a nurse. And so I started looking into some other fields, and physical therapy came into light, and I did some observation in a couple of clinics and really thought this was something that I would enjoy, and decided to do the assistant program versus the PT program, just because PT program was a little bit longer and I was ready to get started.
Is your job meeting your expectations?
Yes, absolutely. I've worked in a variety of places in the hospital, nursing homes, outpatient, pediatrics, home health. So it's been what I've expected and more. It's definitely a rewarding position to be in. You see a lot of injured people, a lot of people with diseases, and it really makes you use your mind and bring out the compassionate part of you, really try to help people out. So yeah, it's definitely met my expectations. I'm glad I got into this field.
Okay. And your last question, any advice for somebody pursuing the same career path?
Yeah, it's definitely not for everyone. I would definitely tell anybody looking into this to do some observation first, go into clinics, into hospitals, and see exactly what is done by a therapist, and then decide, because there are people who get into this program and don't realize that they do have to see things like blood and maybe some other things that they're not comfortable with, and then they wasted their time. So I would definitely do some observations before really deciding to go into this field.
Okay. And just so you know, this is being recorded, and I have permission from you to use this for educational purposes?
Yes, that's fine.
Okay. Thank you for taking time out of your day, and yeah, thank you.
Welcome.